Every year, up to 1 billion people worldwide get the flu. According to the World Health Organization, between 290,000 and 650,000 of them die from it. And yet most people still can't tell the difference between flu and a common cold, a mistake that can have serious consequences. In this video, I'm going to walk you through the exact symptoms of flu, backed by the latest clinical data, show you how to tell it apart from a cold, and tell you exactly when you need to see a doctor. What is the flu? Influenza is an acute respiratory infection caused by influenza A and B viruses. According to the WHO, it occurs in all parts of the world and is one of the most common infectious diseases in human history. Here's what makes flu different from almost every other common illness: the speed of onset, the incubation period. The time between exposure and symptoms is typically just 1 to 2 days. That's why people describe going from feeling fine to being completely flattened within hours. That sudden onset is not dramatic. It is clinically documented. And interestingly, a CDC household study conducted across flu seasons from 2017 to 2023 found that 8% of people who tested positive for flu had no symptoms at all, meaning the virus was spreading silently around them. Now let's talk symptoms. And I want to give you real numbers here, not vague descriptions. A nationwide prospective study published in 2025 tracking U.S. adults during the 2024/25 flu season found the following. The most frequently reported symptom in week 1 was cough, affecting 75% of patients, followed by stuffy or runny nose in 65%, fatigue in 39%, and post-exertional malaise, that feeling of being wiped out after any activity, in 31% of patients. Let's go through each symptom: fever and chills. According to the CDC, flu is typically characterized by the abrupt onset of fever, chills, muscle aches, headache, and non-productive cough. However, and this is important, not everyone gets a fever. The CDC notes this is especially true in older adults and immunosuppressed individuals, body aches and muscle pain. This is the symptom that people remember most. When your immune system detects the flu virus, it releases chemicals called cytokines. These trigger the inflammatory response that causes that deep, whole-body aching. It is not just in your muscles. It feels systemic. That's because it is extreme fatigue. Flu symptoms usually come on quickly, often within hours, and fatigue can linger 1 to 2 weeks after the fever breaks, as inflammation from the immune response continues to settle. Headache. A throbbing headache, often behind the eyes, is a classic flu symptom, driven by the same cytokine inflammatory response. Dry cough. The CDC classifies the flu cough as typically non-productive, meaning you're not bringing anything up. It's persistent and can last well beyond the acute phase. Vomiting and diarrhea. These are more common in children than adults, but they can occur alongside the respiratory symptoms. Flu versus cold. This is the most searched question on this topic. And the answer is actually quite straightforward once you know what to look for. The symptoms of influenza are similar to those of a cold, although usually more severe and less likely to include a runny nose. Here's the clinical distinction. A cold develops gradually over 1 to 3 days. You get a runny nose, mild sore throat, maybe a slight temperature. You feel rough but functional. Flu hits within hours. The fever is high, the body aches are severe, and the fatigue is incapacitating. As Johns Hopkins medicine puts it, flu makes people very sick with several or all symptoms simultaneously. The practical test: if you can push through your day, it's likely a cold. If getting off the sofa feels genuinely impossible, that points strongly to flu. How long does it last? According to the CDC, uncomplicated flu signs and symptoms typically resolve after 3 to 7 days for the majority of people, although cough and malaise can persist for more than 2 weeks, especially in older adults and those with chronic lung disease. Johns Hopkins medicine confirms that fever and body aches often last 3 to 7 days, but cough and fatigue may linger for 2 weeks or more. So if you're still feeling drained 2 weeks after the acute phase, that is clinically normal and documented. When to see a doctor. The WHO states that most people recover from fever and other symptoms within a week without requiring medical attention. However, flu can cause severe illness or death, especially in people at high risk. Go to a doctor immediately if you experience difficulty breathing or shortness of breath, chest pain or pressure, confusion or sudden mental changes. Symptoms that improve, then suddenly worsen. This can indicate a secondary bacterial infection. Persistent high fever not responding to paracetamol high-risk groups, including those over 65, pregnant women, people with diabetes, asthma, or weakened immune systems, should seek medical advice earlier rather than later. Treatment. What the evidence says. Here's where the data gets really important. Antiviral medications, specifically neuraminidase inhibitors like oseltamivir, Tamiflu, are the primary evidence-based treatment for flu, but timing is everything. According to a 2024 systematic review and network meta-analysis of randomized controlled trials published in the Lancet, antiviral treatment of flu in high-risk and hospitalized patients can reduce the risk of serious complications. But treatment shortens the duration of symptoms by approximately 1 day when started early. The key finding from multiple RCTs: antivirals must be started within 48 hours of symptom onset to have meaningful effect. After that window, the benefit drops significantly. For home treatment, the evidence is clear. Rest and adequate fluid intake remain the cornerstone of flu management for most people, with medical care reserved for severe cases and high-risk individuals. The flu vaccine is not perfect. No vaccine is, but the evidence is clear. According to clinical data from the CDC and peer-reviewed studies, the flu vaccine reduces your risk of serious complications, hospitalization, and death, particularly in high-risk groups like the elderly, pregnant women, and those with chronic conditions. Think of it this way: even in seasons where the vaccine doesn't fully prevent infection, vaccinated people who do get the flu tend to experience milder symptoms, recover faster, and are significantly less likely to end up in hospital. That is not a small thing. That is the difference between being unwell for a week and ending up on a ventilator. The annual flu vaccine is recommended by the WHO, the CDC, and every major health authority worldwide. Getting it every year is one of the simplest, most evidence-backed decisions you can make for your health. If you found this video helpful, subscribe. Because every week we break down the health questions millions of people are searching for, backed by real clinical data. Stay well and go get your flu shot.